In the world of pregnancy and childbirth, the term preterm or pre-labor rupture of membranes, abbreviated as PROM, refers to the breaking of the amniotic sac before labor begins, specifically when this occurs before 37 weeks of pregnancy. The amniotic sac, a vital component of a developing pregnancy, contains a fluid that surrounds and cushions the unborn baby throughout the pregnancy, providing a protective environment that is crucial for the development of the baby's organs and systems. This fluid, known as amniotic fluid, not only protects the baby from external pressures, but also aids in the proper growth of limbs and muscles, facilitates lung development, and maintains a constant temperature. The premature rupture of this sac can be a startling event for any expectant mother. It often leads to the sudden gush or a slow leak of fluids, which is usually the first sign that prompts an immediate consultation with healthcare professionals. The risks associated with PROM are significant because once protective barrier of the amniotic fluid is compromised, the risks of infection both to the mother and the baby escalate. Moreover, without the cushioning fluid, the baby is more vulnerable to injuries. Management and monitoring strategies become crucial post-PROM to ensure the health and safety of both the mother and the baby. Healthcare providers might suggest hospitalization to closely monitor the baby's heartbeat and maternal signs of infection, often employing antibiotics or steroids to enhance the baby's lung maturity if early delivery becomes inevitable. The timing of the delivery is carefully considered based on the gestational age of the baby and the associated risks of continuing or ending the pregnancy prematurely. When it ruptures prematurely, it can lead to several complications, including infections and premature delivery. Why does PROM occur? The exact causes often remain cloaked in ambiguity, but several factors can elevate the risk. These include a history of PROM in previous pregnancies, inflammation of the fetal membranes and vaginal infections. Certain procedures, such as amniocentesis, or physical factors like a short cervix, can also predispose someone to this condition. Genetic predispositions may also play a significant role, influencing the structural integrity of the membranes themselves. Environmental factors such as exposure to certain chemicals or pollutants have been studied for their potential to weaken the fetal membranes and increase the risk of PROM. Nutritional status is another crucial aspect. Deficiencies in certain nutrients like vitamin C and zinc have been linked to weaker membranes and a higher risk of rupture. Stress is another factor that shouldn't be overlooked. High levels of physical or emotional stress can lead to hormonal imbalances which might weaken the membranes or induce labor prematurely. Furthermore, inadequate prenatal care is a significant risk factor. Regular checkups can often prevent or manage conditions that might lead to PROM. Women who do not receive consistent prenatal care are at a higher risk of undiagnosed infections or other conditions that could contribute to the complication. Additionally, age plays a role. Teen mothers and women over the age of 35 have a higher incidence of PROM. This is likely due to the varying physiological challenges and risks associated with these age groups. Also, socioeconomic status can influence the likelihood of, as it often affects one's access to quality healthcare and nutrition. As we move on to other risk factors, aspects such as smoking during pregnancy, being underweight, or having a history of preterm birth can significantly increase the likelihood of experiencing PROM. Moreover, carrying more than one baby, like twins or triplets, stretches the membranes more, which might contribute to their premature rupture. Identifying the signs and symptoms of PROM is vital. The most prominent indicator is the unexpected and sudden leaking or gushing of fluid from the vagina. This fluid, known as amniotic fluid, can emerge in varying degrees of flow, from a slight trickle to a significant rush, depending on the situation. Women experiencing these symptoms might also notice a persistent feeling of wetness around the vagina or on the inner thighs, which can be both uncomfortable and alarming. In some cases, additional symptoms can appear, such as a mild bleeding or an increase in vaginal discharge, which may vary from the usual in terms of color and consistency. For healthcare providers, diagnosing PROM involves a careful and thorough examination. This condition necessitates a precise diagnosis because it can significantly influence the management and outcome of the pregnancy. Tests employed in diagnosing PROM include the nitrazine paper test, which is utilized to check the pH level of the fluid. Amniotic fluid typically has a higher pH level compared to normal vaginal secretions. and this test helps in distinguishing between the two. Another diagnostic tool is which is used to assess the level of amniotic fluid surrounding the baby. A significant reduction in this fluid can be a clear indicator of PROM. Moreover, the healthcare provider might conduct a speculum examination to visually inspect the cervix and vagina for signs of fluid leakage. This method can also help in ruling out other conditions that might mimic PROM, such as a urinary tract infection, which can also cause leakage. Prompt and accurate detection of PROM is essential not only for the health of the mother, but also for ensuring the well-being of the baby. It enables timely and appropriate interventions, which can prevent complications such as infections or preterm labor. Therefore, identifying the signs of PROM quickly and accurately is critical for the effective management of this pregnancy complication. The accurate detection of PROM is crucial for appropriate management. Treatment strategies depend on the stage of pregnancy and the overall health of the mother and baby. In cases where the premature rupture of membranes, PROM, occurs, the timing within the pregnancy determines the course of medical action. If PROM happens close to the due date, the clinical decision often leans towards inducing labor. This is because the benefits of delivering the baby typically surpass the potential complications of continuing the pregnancy, which might lead to infection or other issues. On the other hand, if PROM occurs well before the expected delivery date, the treatment strategy shifts towards extending the pregnancy as safely as possible. This involves a delicate balance of interventions that cater to both the immediate health of the mother and the developmental needs of the baby. Medical teams may administer antibiotics to ward off infection, which is a heightened risk due to the ruptured membranes. Additionally, corticosteroids are frequently prescribed to enhance the baby's lung maturity, preparing them for an earlier than anticipated birth. During this waiting period, the mother's condition is closely monitored through regular hospital visits or in-home healthcare services. The healthcare team looks for signs of labor initiation or any indications of infection. They may also perform regular ultrasounds and non-stress tests to ensure that the baby is developing appropriately under the circumstances. Home care after such an event is critically important. The mother is advised to maintain strict hygiene in the vaginal area to prevent infections. This includes avoiding the use of tampons and foregoing sexual intercourse during the remainder of the pregnancy. Such precautions are vital, as the introduction of bacteria into the vaginal area could lead to complications for both the mother and the baby. Moreover, regular follow-ups with a healthcare provider are indispensable during this delicate time. These visits help to continuously assess the health status of both mother and child, ensuring that any emerging issues can be addressed promptly. Through a combination of professional medical care and diligent personal management, the risks associated with PROM can be significantly mitigated, aiming for a healthy outcome for both mother and baby. Regular follow-ups with a healthcare provider are essential to monitor the health of both mother and baby. Immediate medical help should be sought if there are signs of labor, notably if the amniotic fluid has a strong odor or unusual color, suggesting infection or meconium presence. It's critical to also monitor any reduction in the baby's movements. Preterm or pre-labor rupture of membranes demands urgent and meticulous care. Recognizing symptoms and understanding risk factors are vital for protecting both mother and child. Always stay informed, stay observant, and consult healthcare professionals to navigate this complex condition effectively.